This is the golden word. Sex is like air. It is not important unless you aren't getting it. So I am just waiting in between you and the lunch, but I am not going to extend my talk more than 15 minutes. So be rest assured, we'll finish sharp in 15 minutes. So this is a topic which I have taken, that is Post Coital Unusual Events. Now, many of us will say that the commonest event what we find post-coital is like, commonest symptom is the headache. So post-coital headache patients will come. Sometimes patients get some unusual events. I came across some cases which I will be presenting. A couple of them are my original cases, couple of them are published cases which I have not seen, but they are interesting ones. So let's start. This was a 32-year-old male who had come with his wife with complaints of an episode of a GTCS, generalized tonic-clonic seizures, immediately after having the sexual intercourse. Now wife, first time recently married, wife was in a shock. Ye kya ho gaya? We had just intercourse and now he is having a GTCS. And in our Indian culture, wife is kalankit. So she was like stressed, ki kya ho gaya na aisa. So no previous history of seizures, no other psychiatric illness, no any substance use. Now in psychiatry, anyone, if a female patient would have come, I would have thought of pseudo seizures. A first night and she is throwing a convulsion, I would think of a pseudo seizure. But now this was a male and young male. So this is definitely not a pseudo seizure. But as we do all the routine investigations, they all turned out to be normal. Fortunately, EEG was also normal. But in 50% of our clinical practice, we know that GTCS comes normal on EEG. So clinically, I said what it is. So I just asked Dr. Google and I found a couple of case reports of post-coital or post-orgasmic seizures. So I diagnosed him as having post-coital seizures. Now as his EEG was normal and no other abnormalities were found, I advised him to take tablet clobazam 5 mg 1 hour before the next intercourse. Fortunately or unfortunately, the patient has not followed up till date, so I think he did not have any seizures and he must be doing fine. So this is an interesting case of post-coital seizures, and as I said, in literature there are only 3 publications which I have found on it. So they are there is orgasm-induced seizures or the post-coital seizures, and majority in the cases are of females. Here I got a male. Now there is this theory what says that this event or the stimulus or the focus is in the right cerebral hemisphere, which is the center of your seizure. Now what happens that the autonomic effects of the orgasm, now during orgasm the blood pressure increases, the heart rate increases, there is an adrenergic surge. Now this can lead to the stimulus of the epileptogenic brain area, and that leads to the seizure. Now differential diagnosis, as we discussed, is the pseudo seizure, and there is something called as orgasm induced cataplexy also, like muscle paralysis. That is orgasm induced. Moving on to the next case. Now he is a 24-year-old male. Now he complains of low mood, generalized fatigue, irritability and crying spells after having sexual intercourse. Now this is since 6 months these episodes are happening. After each sexual intercourse, he is having this mood features of sadness and crying spells. And these features last for 30 to 90 minutes after the intercourse. Now gradually his condition is deteriorating as the duration of symptoms is increasing following subsequent intercourse. And this is leading to problem with the relationship with his wife. No lack of desire in engaging in sexual activity. Similar findings were present when he used to masturbate at a younger age, but it were not that severe to take any medical help. So this is classically a case of something called as post-coital dysphoria. And then sadness of mood is there, so we prescribe SSRIs, that is tablet escitalopram, 10 mg once a day, and some psychoeducation to his wife and to him was done. and is found significant relief on follow-up. So this is something called as post coital dysphoria, which is there in the literature. Now what happens, the resolution phase of our DEOR, it says that resolution phase is characterized by euphoric feelings and sensations following the sexual activity. This happens in the majority of the cases. But some individuals will experience the negative effects during the resolution phase. So that's why the term is something called as post-coital tristesse or the post-sex blues. So similar to our postpartum blues, there is something called as post-sex blues. It is a paradoxical or the counterintuitive occurrence when generally satisfying sexual activity is followed by this unexplainable sensation of tearfulness, melancholy, and irritation. So you have to remember the desire is good, the experience is also good, but the symptoms of mood is coming to this patient. There are studies which say that almost 42% of the females or the 46% of the females suffer from post-coital dysphoria and about 42% of the males suffer from post-coital dysphoria, and we don't ask in our clinical practice about this PCD. There are some relationships of PCD with hypoactive sexual desire disorder, premature ejaculation, and the delayed ejaculation. Moving on to the case 3. Now this was a 31-year-old female. She developed mutism, refusal of food, and aggressiveness since the day after the wedding. Now this wedding was done well, everything was good, and it was consummated on the first night without any real incident. Now she was very much anxious and worried. Now this is not my original case, this is a published case. Now in her culture, what it was that on the first night, that is the Suhag Raat, in the morning next day, the relatives will wait outside the door to see the bed sheet, that how much bleeding has been happened on the bed sheet, because that is a sign of the losing of her virginity and the sign of viralism of the male. Now she was already anxious because next day the relatives are going to be waiting outside. Because she had very mild bleeding, so she was already worried, stressed. In fact, she was uncertain of the reaction of the family. She ran away from the house without informing anyone. And then later on, she was found wandering somewhere and the police brought her to the family. When she was brought, she was having this incoherent speech, audiovisual hallucinations, and suspiciousness or delusions towards others around her. Now, this is a classically in our clinical practice, many of them are psychiatrists will say it is a brief psychotic episode. So yes, it is a brief psychotic episode, and in literature, this is something called as post-sex psychosis, or it is called as the nuptial psychosis. It is a culture-bound syndrome. The case which I have taken is from this Tunisian culture. In India also, it is very much mentioned in the culture-bound syndromes. So it is due to the stress-induced dissociation or the psychotic episode. So sometimes we can say it is a dissociative disorder, or it can be labeled as a brief psychotic. So in future, she might be prone to go to schizophrenia. So it is a dissociative or the psychotic state occurring in the young brides who are poorly prepared for marriage, and it occurs due to the sexual trauma, separation for the family, or symptoms of confusion, hysteria, and suicidal ideations. So this was an interesting case. Coming to the last case, it is about this 52-year-old male. He is brought to the emergency department by his wife after a sexual intercourse. Now he had complained of some headache on the back of his head, but not associated with our light sensation, nausea, or vomiting. This after headache, he has the complaints of confusion, experienced difficulty to remember what had happened that night. And he also had difficulty to remember his children's name, and also he knew that he is his wife, but he did not recall any other memories. He kept on asking the same questions. So it is classically some kind of memory or the amnesia. No other weakness or sensory deficit or any paralysis or anything was found. No seizure, no fever, no any head injury also. कि during the sex कुछ जोर से हुआ और लग भी गया क्या, nothing. No intake of any alcohol or any drugs before that. he said that he was awake during this episode of this amnesia, and it lasted for about 30 minutes with gradual resolution. And now he remembers everything well. But that episode he has forgotten. So this is a classic case of a transient global amnesia. And TGA is very much common, but the precipitating factor here is the sex. So post-sexual transient global amnesia is the diagnosis, or the post-coital amnesia. Now again, the pathophysiology of this post-coital amnesia is the sympathetic activity. As I said, adrenergic rush is there. And what happens with this sympathetic activity activation and this Valsalva maneuver, there is a retrograde transmission of high venous pressure to the cerebral venous system, leading to the venous ischemia in the brain, and thereby leading to the transient global amnesia. So in literal sense, we can call it as a mind-blowing sex, sir. So coming to this, a terminology has been come, and it is now recently very much aware of, everyone is reading on this, something called as post-orgasmic illness syndrome. Now I don't know, very funnily, for the males they will use the terminology post-orgasmic illness syndrome, for the females they will use the term post-coital psychological symptom. It is just a funny thing, it's both the same, what I feel. So in the post-orgasmic illness syndrome, the patients will have symptoms of anxiety, irritability, fatigue and headache, or you can have crying and mood swings. They have laid down some criteria also of the division of the symptoms. Again, as I don't know why they have told that in females these symptoms will be there, it is common in both the genders. So there is this central aversive symptoms like disorientation, confusion, impaired judgment, decreased verbal memory, anxiety, insomnia, laughter, post-coital dysphoria, post-coital trespassy as we discussed, seizures, fatigue, muscle weakness, paralysis or headache. We will have peripheral aversive symptoms also like diarrhea, very funny. So after intercourse you have to be in the washroom. Constipation, muscle ache, sneezing. This is also very funny fact. So if you hear your neighbor at 3 a.m. sneezing continuously, you remember what has happened. Abdominal pain, diaphoresis, hot flushes, pruritus, facial or ear pain, and genital pain, which we are aware of. So this is the post-coital abnormal events. So thank you. This is the golden word. Sex is like air. It is not important unless you aren't getting it. So thank you. Yes.
Thank you, Dr. Sagar Karia, for your mind-blowing presentation.
Thank you, sir. Thank you.
This is regarding the schizophrenia, which
Yeah.
you are just talking. Like, do we have to relate with the history, or it is just a episode which has occurred suddenly?
Yeah. So very apt question. As I said, the history says that it was precipitated there and it was a brief psychotic episode. So in psychiatry we say it is an acute transient psychosis, or in ICD it is said as polymorphic psychosis because dissociative symptoms, some mood symptoms and some psychotic symptoms. So we have to follow up such patient and we see whether it was just an acute stage stressor and dissociative, or she is now going into schizophrenia. She may go to schizophrenia also later on.
Then it is a beginning of...
Beginning or the start. Yes.
I came across recently only post-coital giddiness, and it's last throughout a day. And the patient is a known case of anxiety. Means he is on treatment. So what to do in such case? Like
So what I would have done, I would have given SSRI, which would have...
for giddiness.
Paroxetine, I have tried and used. But because I am a psychiatrist, I will use psychological medicine. So paroxetine would have helped.
Already on anti-anxiety. Known
But
case of
paroxetine,
anxiety.
particularly paroxetine. Huh? Yeah, 12.5 to 25. Yes, sir. Yes.
Dr. Sagar, in the case 1 and case 2, you told the treatment of clobazepam and escitalopram. Do we have to worry about erectile dysfunction, as these drugs are known to cause erectile dysfunction later on?
Okay.
Because we are giving for that erection for the sex only.
Yes, yes. So very valid question. Coming to the post-coital seizures. Now in my case, there was EEG was normal, but in the literature, EEG was abnormal and they had given anti-epileptics to continuous patients because there were bursts in the EEG. So it is two approach. You can give anti-epileptic, you wait like me, give SOS, clobazam and see. Now coming to the second question of escitalopram, in our clinical practice also, escitalopram is not known to cause sexual dysfunctions very widely. And if it is causing, it causes in the initial days, but later on the patient gets used to. If the patient complains, कि नहीं इससे मेरा भी desire भी कम हो गया, then we have a newer antidepressants like vilazodone, vortioxetine, which can be used and it does not cause more sexual side effects. So you can change later on.
Okay. And what about the treatment for that amnesia patient? Like how
Yeah.
to treat for that?
No treatment. In literature, we have seen there are a couple of cases also. They did not do anything. They had kept him under observation. MRI वगैरह कर लिया. If MRI is normal, no treatment to be given. If MRI में there is something, then you give your blood thinners and other treatment as routinely.
Thank you.
Yes. As I said, literature says 46%. We have not asked only. So patient have not come to us with the post-orgasmic illness syndrome unless this couple of cases which were unusual, so they had come. So what I suggest that we should routinely do some screening questionnaire or something, and we ask, and then we'll come to know कि only SSRIs are going to help or we need to give something else. We have not yet done anything on that. Yes.
So one more approach is that it could be a IgA hypersensitivity. So what I've been trying to do is that what the dermatologists do is desensitization. So taking the patient's own semen, then autoclaving it, then injecting it, because SSRIs for 6 months have found to be no benefit in post-orgasmic illness syndrome. So this therapy along with metoprolol and this have found to be 30 to 40% effective. Till date, not a single patient of post-orgasmic illness syndrome is completely well of his symptoms. So if any of the brilliant psychiatrists here can throw a light on that, how to treat such patients. Symptoms only severe weakness after masturbation, severe weakness, fever after sex.
So point has been taken. We will definitely read on it and we'll refer the patients to you, sir. Definitely.
Sir,
We will do the
sir, last
discussions
question.
after the lunch, sir.
Can I put
It
one
is-
question last? Yeah. Sir, actually, in the last case,
Can be asked later, after this. Okay.
I invite Dr. Parasha, sir, to felicitate Dr. Sagar Karia, sir.